A Pap smear is a simple test to screen for cancer of the cervix. The cervix is the lower portion of the uterus which connects the uterus to the vagina. This Pap smear involves taking a smear from the cervix, and these cells are then put on a slide or in a liquid medium and sent to the lab for examination. India accounts for nearly 1/4 of the world's burden of cervical cancer deaths, and all these deaths can be prevented if you get a Pap smear. Now, 97% of cervical cancers are caused by a virus called the human papilloma virus. This virus is transmitted through sexual contact from person to person. All sexually active women do get infected with human papilloma virus once in their lifetime. Most normally, when you get infected by the human papilloma virus, if it's a low-grade infection, it gets resolved by itself due to the innate immunity in the individual. Sometimes, if you are infected with a high-grade human papilloma virus, these infections tend to last and over a period of 3 to 7 years, they cause various changes in the cervix, which then lead to cervical cancer. So these changes that occur in the 3 to 7 year period can be picked up by doing a Pap smear test, and hence it can detect changes before they lead to cancer and can be treated precancerously. All sexually active women should start getting a Pap smear done right from the age of 21 years. All women between the age of 21 to 29 years should get a Pap smear done once every 3 years. After the age of 30, that is from the 30 to 65 years, you should get a Pap smear done once every 3 years. And if you combine this with the HPV testing, that is testing for the human papilloma virus, then it can be done once every 5 years. You can stop doing the Pap smear at the age of 65 if you've had 3 consecutive negative Pap smears done at an interval of every 3 years, or if you've co-tested it with HPV DNA. If you have 2 negative smears consecutively, then the screening can be stopped. A Pap smear is a simple outpatient procedure. It does not require anesthesia. It is done in the OPD, wherein you're made to lie down and the cervix is visualized by introducing a small instrument into your vagina, and a smear is taken from the cervix. Now, while scheduling your Pap smear, make sure that you're not bleeding and you schedule it right after your periods. If there is any infection at the time of examination, then the infection is treated and the Pap smear is done 2 weeks later. It is advised that you avoid sexual intercourse at least 24 hours before doing the test. And in case you're using any vaginal douches or creams, then it is advised to stop using these at least 48 hours prior to the test. Pap smear is only a screening test, and the abnormal results do not mean that you have cancer. Once we look at the report, based on the findings, we decide what is to be done next. If the report suggests low-grade changes, then you only need to do a repeat follow-up smear in a short duration within 3 to 6 months. But if there are high-grade changes, then further testing in the form of colposcopy or a cervical biopsy is warranted. Hence, Pap smear is only a screening test, and it's high time each one of us take the step forward and get a Pap smear done. So how much does a Pap smear cost? At Aster RV Hospital, a Pap smear costs 1,400 rupees, but to increase the number of patients coming forward and getting the Pap smear test done, we have introduced the Diva package, in which the Pap smear is included along with certain blood tests, and it costs only $9.99. So come forward and get your smear done today.